Today, 10 investigates an effort to rethink emergency response, but some say it doesn't go far enough. 3,000, that's how many times Columbus's specialized 911 unit has been dispatched this year for mental health crises. Tonight, 10 investigates reporter Rochelle Elaine spoke to a group that brought their concerns to our 10 TV Listens town hall in Eastland. And they told us they're hoping to expand that program by putting a major change on an upcoming ballot.
In January of 2017,
911, what is the address of your emergency?
3271 Medina Avenue.
Columbus dispatchers took this call from Jerron Thomas with a shocking level
I need an ambulance.
of foreshadowing.
That feels like I'm going to die or something because I keep hearing these voices.
An autopsy report shows Thomas did die 9 days later of cocaine-induced delirium and cardiac arrest that cut off oxygen to his brain. Records show that responding officers used force on Thomas before he was taken to the hospital. Thomas's family doesn't agree with how things were handled, and they're now pushing for a different type of response to 911 calls like his.
Hi.
Thomas's sister, Chana Wiley, is a leader with the Columbus Safety Collective. They're working to gather the 25,000 signatures needed to put this petition on an upcoming ballot.
We'd have a team of trained clinicians, peer supporters, social workers that can respond to these health crises.
It would require the city to set aside $5 million by 2027 to create a community crisis response division. According to Wiley, they would provide a non-police response to low-level mental health and substance abuse calls. Now, it's important to note the city already runs several similar programs called the Alternative Crisis Response. And this year alone, the city set aside $7.5 million to keep them going. So we asked Wiley about it.
What would make this initiative different than some of those pilot programs?
Well, what makes this initiative different is that, for one, it's not a co-responder model. It is a model that is comprised of people and professionals that are specifically trained to respond to these types of calls, to provide resources. It would be open 24 hours a day, 7 days a week.
But what do police think about this push? We asked the local union president.
It sounds like this really hinges on dispatch, getting it right and figuring out who's the appropriate responder.
Which is very hard because sometimes when people call, what they send you for is not what you find.
While Lieutenant Brian Steele worries about the safety of those responding, here's why he says the FOP ultimately supports this push.
The bottom line, if someone's in a mental health crisis, we want to get to them, we want to get to them quick, and we want to get them the help they need, and maybe that is not the police.
And as she continues to collect signatures, here's why Wiley says you should care too.
Because it could be their neighbor. It could actually be them themselves, because you don't have to have a diagnosis to have a bad day.
In Columbus, Rochelle Elaine, 10 TV News.